Do you know which hormonal birth control has been on the market the longest? So, when you're taking hormonal birth control, are you actually increasing the hormones in your body? What plant do you know of was used in the past as a form of birth control? Do you know whether or not hormonal birth control can cause cancer? Do you know whether or not birth control pills really do affect your fertility? What are the most common side effects of taking birth control pills? Because you're wondering, but I know somebody who said they gained a whole lot of weight when they were on hormonal birth control. So, how did that happen? Let me explain. Hey guys, we're back for another episode, and today we're going to touch on the myths and the truths of birth control, specifically hormonal birth control. And it's because it's been all over the news. There's been so much concern about whether or not we're going to have limited access or reduced access to hormonal birth control in the near future. And so, a lot of things that are being mentioned as to the reasoning behind the desire to restrict use has been causing so much confusion. People don't know what's truth and what's myth. And on this platform, our goal is to make sure we help you work through the weeds and the misinformation of science on the internet, on the social and the medias. We want to make sure that you have access to experts like ourselves who have been in our fields for decades that can provide you the information that's most accurate based on evidence-based medicine and help you kind of figure out what's truth and what's myth. So today's topic is hormonal birth control. If you value this information, don't forget to go ahead and click subscribe, give us a thumbs up, and most importantly, make sure you click that bell so that you know every time we do what? Drop another episode.
And what caused her urinary pain? Birth control pills and spironolactone for her acne.
What? Hold on a second. Birth control pills and that medication for hormonal acne?
Yes.
Which I have two daughters in their 20s.
So those medicines work to block testosterone. And so that's why they help with the acne. Now, I'm not saying you should never be on these medications, but when you play with hormones, there can be consequences.
I don't know how many ways to say they are coming for birth control. Today, 121 million Americans, over 1/3 of the country, live in states actively restricting or attempting to restrict contraception.
So that we're clear, everyone, I am Dr. T, and I am the founder of HBC. I'm also a certified OBGYN, and I've been in the field now for decades. I'm aging myself. But today, my goal is not to convince you to take or not take birth control. That is not my position. I'm not your healthcare provider. My goal and the goal of the other experts is just to help you kind of figure out what's true and what's not true and give you the evidence-based medicine, the factual stuff. Now, today we're going to focus on hormonal birth control, but I do want to make sure it is known that when we ask what form of birth control would you like to use, we're talking about the entire group and gamut of birth control methods, which include hormonal and non-hormonal. So you don't always have to feel like you have to choose a hormonal birth control method. If you've been using a non-hormonal method and it's been working well for you and you're consistent with it, then go ahead. If it works for you, it works for you. Everyone's going to make different choices because everyone has different health care. Everyone has different health histories. Everyone has different lifestyles and priorities and belief systems. So no one's going to make the same decision. And there is no one choice for everyone. One size does not fit all. Let's also make it known that you don't have to feel like you're committing for life. This is not matrimonial. You do not have to choose a birth control method that you're going to stick with for life. It's okay for you to change your mind. Girl, change your mind if you need to, because the goal is for you to find the right fit. And sometimes, like many decisions in life, including our partners, we make the wrong decision initially, and then eventually we get it right. Or keep in mind that the woman you were yesterday may not be the same woman you are today. And so the choice that was great for you before may not be the same choice that is best for you now. It's okay to change your mind. Okay, now that we've got that settled, let's get into some of these facts and fiction. Now, birth control methods have been on the market for a very long time. Do you know that the oldest method of birth control is the withdrawal method? Yes, that method has been around, some would say, as old as biblical times. And over the many years, we have changed and evolved into the options that we have today. Do you know a plant-based option that was used in ancient Greek and the Mediterranean cultures? I'll give you a second to think about it. What plant do you know of was used in the past as a form of birth control method? I wish I had my Jeopardy music for y'all, but we're going to jump right into this information. So, in ancient Greek and Mediterranean cultures, they use things like pomegranate, fennel, and initially, the actual very first hormonal birth control called Enovid was actually made using wild yam root. So, yeah, so if you look at a lot of our cultures today that have ancient roots, no pun intended, you will see that oftentimes they will use a lot of these older methods or plant-based methods, and they're not pulling it out of the sky. There is scientific basis to this. Now, Enovid was introduced and approved initially in 1957 for menstrual disorders. So the actual initial form of hormonal birth control, the pill, was not introduced initially for contraception. It was actually introduced initially for the management of irregular menstrual cycles. It didn't become approved for contraception until 1960. And you guys know I've shared on this platform the history, a little bit of a darker history of the approval of the original birth control pill based on trials in Puerto Rico. If you haven't seen that video, make sure you check it out because that's some important history we all need to be aware of. Now, given the fact that hormonal birth control methods were initially introduced for menstrual irregularities, do you know some of the other common reasons why women may be on hormonal birth control that have nothing to do with contraception? So, some of the more common reasons why women may use contraception include pain disorders, whether they're dealing with menstrual-related cramps, which is dysmenorrhea, or whether they're dealing with chronic pelvic pain issues like endometriosis and other chronic pain syndromes. Now, while birth control pills have been known to be linked with certain side effects, one of which is headaches, some women actually do use birth control pills to manage chronic headaches like migraine, like menstrual-induced migraine headaches. And so women oftentimes may have headaches as a part of their PMS, and so they will utilize birth control, hormonal birth control to control their symptoms. That may not just include headaches, but they may get bloating and mood changes. And they utilize hormonal birth control in order to create a better balance for themselves. Now, women may also use birth control for acne. So, testosterone, which is produced by the ovaries, can actually cause an increase in acne. And in my PCOS women, also hirsutism. And so, we oftentimes will utilize hormonal birth control to help with their hirsutism or acne. Now, one of the questions I get asked almost all the time, if I were to ask you, what is the number one side effect that concerns women when it comes to using hormonal birth control methods? What would you say? So, for example, what would concern you when it comes to using hormonal birth control? What is some of the symptoms that you're concerned about that may make you a little bit hesitant to using hormonal birth control? So for a lot of women, the top things that concern them the most, that they want to know what are the percentages, what are the chances, include symptoms like irregular bleeding, weight gain, decrease in their desire to be intimate, as well as changes in their mood. So let's touch on weight gain in particular. So a lot of women are always concerned about weight gain, and it makes sense, right? Excess weight gain has been linked to a number of adverse outcomes, from cancers to cardiovascular disease to musculoskeletal issues, and the list goes on. So excess weight gain is a concern for everyone, and rightfully so. Overall, when you look at all of the studies, there has been no direct link meaning causation, there has been no direct link between hormonal birth control methods and weight gain overall. Because you're wondering, but I know somebody who said they gained a whole lot of weight when they were on hormonal birth control. So how did that happen? Let me explain. So, throughout our life cycle, there are a lot of time periods where our weight will shift and change. And it has to do with a multitude of things, whether it's our psychological health, whether or not we are sedentary, whether or not we're under high stress, whether or not we are having some sort of physical issue otherwise that is contributing to weight gain. So, a lot of times, women are going through changes, and because there has been this general concern about weight gain when it comes to hormonal birth controls, a lot of times the first go-to that women will say is the cause of their weight gain is going to be hormonal birth control. Okay, if it's the birth control, let's stop the birth control. And guess what happens when they stop the birth control? The weight doesn't go away, and then they start blaming the birth control caused them to have chronic weight changes. So this is what's really important. I will tell you anecdotally in my patient population, when I look at the women who report weight gain and the women who don't report weight gain, this is not scientifically based because I did not do a formal study, but I can tell you anecdotally, the women who do well and don't experience weight gain changes are those who have active lifestyles and are living a healthier lifestyle. Well, tell me about other things that are going on in your life currently. And I will find high stress levels. I will find sedentary lifestyles. They're not physically active. They're not exercising. They're not eating well. And as we get older, especially when we're on the same thing that happens when we're on these medications is that we start to age and we get older. And as we get older, our metabolism changes. And so it's really hard to just assume right off the bat that the weight change is due to hormonal birth control. I would really encourage everyone to really take inventory of your entire life to see whether or not truly birth control methods are really the underlying cause of your weight gain. And if it is, then so be it. Discontinue the medication. And again, everyone's body is going to be different because these studies were not done on everybody, right? Everybody that walks this earth. These studies are done on a group of women. And the goal is for the group of women who are in all of these studies to have some resemblance of the overall population, but it's never going to represent every single person. And so we also got to pay attention to our bodies. So take inventory, pay attention to your body, and then make the right decision. Now, here's the other thing about, as I mentioned, as we're on hormonal birth control, we're also getting older. And so one of the other questions that is oftentimes asked is, does hormonal birth control affect my fertility in the future? What do you think? The answer is no, it doesn't. Pretty much when you come off of birth control, most women will resume their fertility immediately or pretty soon after. There is one exception. Depo-Provera has been shown to delay the resumption of someone's cycle. Until your cycle starts to regulate again, you won't be able to conceive because you require a cycle that goes through and have ovulation in order to be able to conceive. But there has been no study that has shown any long-term effects on your fertility. Okay. One of the things that come up often, especially with the birth control methods that use synthetic progesterone, is the question about, am I plugging up inside when I'm not bleeding of birth control? And the answer is no. There is no plug up. There is no backup. There is no blockage that's happening. What is actually happening is the progestin-based birth control methods are thinning out that inside lining of the uterus. So the uterus goes through various changes when your cycle is cycling. And one of the changes is just before implantation or potential implantation of a pregnancy, your uterus becomes on the inner layer called the endometrium, very vascular, very rich in thick, healthy glandular tissue that supports the pregnancy. Outside of that, we don't really need that the level of vascularity. We don't need that level of richness in terms of the glandular tissue. So that endometrium lining does not need to be thickened unless we're preparing for a potential pregnancy. And so these progestin methods actually thin out that inside lining so there's nothing to shed. Otherwise, when you go through your unmedicated cycles, you will have this thickening process that happens. And when you don't conceive, then that excess tissue sheds, and that's what creates your menstrual flow. So unless you are going through that particular cycle, you don't really need to have a flow. And these methods also can be protective, and I'll talk a little bit more about which methods are protective in a second. Before we jump into that, let's get into this myth about needing to have a child to use certain birth control methods. So, do you need to have a child to use all birth control methods? So, do you need to have had a child to use the IUD? That is a question that comes up often. And the answer is no. Women who do not have children are still candidates for the IUD. The IUD does not disrupt your ability to get pregnant. It does not disrupt your ability to implant a pregnancy. It does not affect your fertility. In fact, some IUDs are protective, and I'll talk about that in a moment. But just so that you guys know, you do not have had to have a child in order to have an IUD inserted. Now, while the use of an IUD is safe for all women, children, no children, 1 child, 10 kids, doesn't matter. The IUD is an option for birth control for all levels of parity. Now, that being said, there are some differences with experiences for those who had children before and those who didn't. For those who've had children before, it is easier to insert the IUD because that opening of the cervix is a little bit easier to insert the instruments through because a whole baby in some cases have passed through that cervix. And so oftentimes it's a little bit easier. And you will also see differences between the ease of the insertion of the IUD with women who have had at least 1 vaginal delivery and those who have had all C-sections. So when that cervix has been opened before, it logically is easier to insert something through that cervix to be able to place the IUD inside of the womb. However, women who have, for example, the IUD inserted right after childbirth, there is a higher level of expulsion. Similarly, women who have never had children before also experience a higher level of spontaneous expulsion of the IUD. And that can cause some cramping, sometimes a little bit of bleeding, but is actually pretty well tolerated for most who have had that experience. And that is not a common experience, but it is a potential experience for those using the IUD who are in these primary categories. Immediately after childbirth, never had a child before. Now, pain is also more common with those who have never had a child before for the same reason. If I have had a whole baby who has passed through my cervix or have had at least the softening of my cervix with pregnancy, then it makes it much easier to insert the instruments through. And so there's less pain. There's less pain because that cervix has been made pliable. It is a lot more pliable to the insertion of a tiny instrument as is used with the insertion of an IUD for those women who have had children before. That's just kind of common sense. And on that note, all women should receive pain relief. And this is the stance of the American College of Obstetricians and Gynecologists. All women should receive pain control or some type of pain management with the insertion of IUDs. It should never be assumed that pain medication is not needed. So make sure that that's a part of the discussion and preparation for the procedure for all women across the board. One of the things I want to clear up, there seems to be a lot of confusion, especially in the topic of ABs. And it's possibly because everybody's talking about ABs. There's so much legislation that is being considered or passed when it comes to ABs across the country. Now, one of the things that gets confused all the time is the birth control pill, the Plan B, and the AB pill. They are not the same. They have very much different intents. So Plan B or Ella are intended to prevent a pregnancy from happening. That means a pregnancy has not happened at all. We just had unprotected intimacy, and I realized I didn't use barrier methods, or the barrier methods we used broke. And so we want to make sure that we're not able to conceive in this moment because, for whatever reason, and people have a laundry list of reasons why they make these decisions. It's not disrupting a pregnancy. A pregnancy has not happened. And its goal is to prevent that unwanted pregnancy from happening. So pregnancy has not happened. There is no conception. The intent of these medications is to prevent one from happening if it's undesired. Now, the AB pill, however, is disrupting an already existing pregnancy. That's the difference. Again, an AB pill is disrupting an already present pregnancy. So Plan B, Ella, are not the same as the AB pill. They're very, very different. Likewise, the birth control pill isn't doing any of the above. It is intended to either control a hormonal related condition or to prevent you each month from being able to conceive. And so to my sisters out there who find themselves using Plan B or Ella a lot, you may want to have a conversation with your healthcare provider for a better chronic management using some other method of hormonal birth control. So they do not protect you against HIV, herpes, HPV, gonorrhea, chlamydia, syphilis, and the list goes on. They do, however, prevent pregnancy from happening. But the methods that are barrier methods, like your female condoms, your male condoms, protect you against the transmission of a STI, sexually transmitted infection. And they are not 100% protective. Keep that in mind for certain infections, especially like herpes and HPV, which are transmitted by skin-to-skin contact. So again, hormonal birth controls do not prevent STIs. Barrier methods prevent STIs or decrease the risk of transmission of STIs, but do not 100% protect you against certain STIs, especially like herpes and HPV, which are transmitted by skin-to-skin contact. Now, the other thing that individuals should know for those who are in a discordant HIV relationship, meaning one partner is positive, the other partner is negative, those who have an undetectable load are not able to transmit HIV. So undetectable equals untransmittable, just as a reminder. Now let's get into the hormonal levels. So when you're taking hormonal birth control, are you actually increasing the hormones in your body? What do you think? One of the concerns when it comes to hormonal birth control is that people feel that they are actually stacking or increasing their hormonal levels in their bodies, and that is not true. What hormonal birth control is a synthetic form of the hormones that actually circulate in a woman's body, the two main hormones, progesterone and estrogen. And so the synthetic form of hormones then create a low level of hormone that is able to disrupt your natural cycle. So it's not adding to the amount in your body. It's not stacking the hormones in your body. It's leaving your hormones at a low level and disrupting your own cycle from happening, but giving you enough that you're able to have a flow or be able to treat the conditions that you're trying to treat and ultimately also prevent pregnancy from happening. So it is not stacking your hormones. It is giving you a low level of hormone that disrupts your own cycle so that you don't ovulate or so that the environment in the womb becomes inviting for a pregnancy to happen and resulting in contraception. Modern day hormonal methods are using a lower form of hormone. Now, when the hormones initially came on the market, we were using a very high dose of hormone, right? But that has changed. There has been found no need to have such a high dose of hormones in order to disrupt the cycle that leads to conceiving a pregnancy. And likewise, people are always asking the question, do hormonal birth control cause cancers? So one of the interesting thing is while oftentimes the conversation is about hormonal birth control causing cancer, and it's only those who are really using birth control pills for a long term that have a slight increased risk for breast cancer. And in some cases, increased risk for cardiovascular disease like blood clots, strokes, or heart attack, and increased risk for mood disorders like the adolescents that start birth control pills and are on it for a long time period are more likely to experience major depressive disorder as an adult. That is true. Not only does long-term use of hormonal birth control has been linked not only to cancer of the breast, but also cervical cancer as well, specifically, especially birth control pills. Now, on the flip side, what people don't oftentimes talk about is the fact that hormonal birth control actually decreases the risk for certain forms of cancers. So we know that using hormonal birth control decreases the risk for ovarian cancer, which keep in mind there is no screening test for ovarian cancer, unlike cervical cancer and breast cancer. So hormonal birth control really does give a great benefit in reducing the risk of ovarian cancer, but they also reduce the risk of uterine cancer. As I mentioned, especially your progesterone type birth controls, like your IUDs that have the progesterone, they decrease the risk of uterine cancer beautifully. And also cervical cancer. I know it doesn't make sense. So, in one form, certain hormonal birth controls have been linked to increasing the risk of cervical cancer over long-term usage. However, the IUD has been found to actually be protective against cervical cancer. Again, with making all of these decisions, it's important to know, do you have a family history of breast cancer? Do you have a family history of ovarian cancer? Like, making these decisions are so individualized because of our past medical history, our family history, our current situation in terms of our lifestyle, and etc. And so this just goes to show that some people may like one benefit and others may find another benefit or even a risk factor to be more concerning. Now, women who have higher unhealthy BMIs, women who are smokers, and women who have high blood pressure are more likely to experience some of these adverse outcomes with long-term usage. Now, one of the other things that comes up is with Depo-Provera, with the effect on bone density. And that has been found to be reversible with discontinuation of the medication. So keep that in mind as well. And finally, one of the other common questions I get asked all the time is, do I need a pelvic exam in order to start birth control? And the answer is no. In a low-risk person who doesn't have any symptoms in their pelvis, they do not need a pelvic exam to start hormonal birth control. Not having a pelvic exam should not preclude you from being able to start the hormonal birth control of your choice. And again, of your choice. And what did I say in the beginning? You are allowed to change your mind. And that is it for us today. Now, here's my question for you. How many did you get right? Did I discuss some of the myths that you've heard about birth control, hormonal birth control specifically? Did I dispel some of the myths for you? Have you felt like there is more clarity in your decision making? I hope so. I hope I've been able to clear up some of the cloudiness when it comes to hormonal birth control. It is not meant to be the boogeyman, and oftentimes it is being made to be the boogeyman, whereas it's just really an option for women to be able to manage their lifestyle according to what is best for them and for their growing family, or not, depending on what your lifestyle decision is for you and your loved ones. So let me know in the comments below, how many did you get right? It's okay. This is no judgment zone. And or mention something that surprised you that we discussed today that you didn't realize about hormonal birth control. As always, just a reminder that your participation helps us to get this information out to other women who may be looking for this type of information, but just can't seem to comb through the weeds of disinformation and misinformation on the internet. That being said, I am Dr. T, the hand behind the handle of Healthy Bump Club right here on YouTube and Healthy Bump Club on Instagram. Thank you guys for joining me today, and I hope to see you guys when the next episode. Of course, you got it. See you then. This is Dr. T. Just a friendly reminder. Don't forget to comment, like, and share. And go ahead, why not? Click that subscribe button. Help us to get to the next 1,000 subscribers. We thank you guys for supporting.